Thank you very, very much. I'm just, I do have a question that I want to pose to all of our speakers to just get us thinking about some of these implications. But I'm going to offer a bit of a personal reflection, because I've been thinking about, as we've planned this webinar and as we've been piecing this together and having these conversations about the focus, and I'm reflecting on the intergenerational piece especially. And I was thinking about our conversation the other day about how, if we really want to have a healthy older adult population, we actually also have a healthy younger adult population. That means we also have to have a healthy youth population. It means we have to have a healthy child population. So everyone online here is interested in having healthy older adults. Our interventions need to be not just at the older adult stage, and not to minimize the importance of that, but it's intergenerational, it's multi-generational, I think, of our strategies. And I'm thinking of my own family. It's funny you mentioned Bridgewater, Nova Scotia, because my Oikle name comes from the deep south of Nova Scotia, on the South Shore in Bridgewater. And my paternal grandparents, the Oikles, they lived in poverty that was just beyond what any of us could maybe even imagine on this line. And my grandfather, Austin, died of tuberculosis, probably somewhere in his 40s. My father was 5, and there were 14 children in that generation. But as losing, so, spanning ages and generations. And so just when I think about, so tuberculosis is an example of, it's just one of the perfect examples of how the social determinants impact the outcome, and if the family had healthy and stable housing, if the family had income that was sufficient to meet their needs, if they had an environment around them that was supportive and greeted the children and supported the children so that the children could all stay in school. So the children, of course, then couldn't stay in school and needed to go off and needed to work. And, the family continued to live in poverty because the only income earner died. So I'm thinking just about the multi-generational impact of those core socioeconomic determinants not being met for the family unit, and the impact then on, and then my father died young at 60, and probably from a life of poverty. And so just thinking about the cumulative impacts. So this is a bit of rambling, and I don't mean to take up so much space. It's just sort of dawning on me that the cumulative impacts of those inequities and social determinants at multiple generations, and including the social and exclusion and inclusion piece, and how that all results in the health of our older adults. It's a cumulative effect. It's a big cumulative effect, I think. So anyway, I'm open to comments in the chat box to what I've just shared too. But anyway, I think that we were going to have a little bit of a group chat before we are going to take questions from the audience that's here. I have drawn a name for someone who's won the book, but before we get there, I was thinking about what your thoughts are and how can we actually bring the voice of older adults more prominently into this policy process, right? How can we actually give them more of a space and voice to influence what public health and healthcare actually does? So maybe we'll back up and we'll start with Peggy. We'll go back through the order. Peggy, and then Jim, and then Sherry. What do you think?
Wow, that's a great question. And by the way, I would just, before I answer that question as best as I can, I'd like to really support what you just talked about. One of the major underlying themes that came out in the book with 32 chapters was the importance in policy of a life course perspective. You can't just invent policy at older age. It starts at, in pregnancy, and we need a life course perspective.
Yeah.
But in answer to your question about how do we include older people, I think to me, there's 3 things. Number 1 is include them. I just can't tell you how many times older people just aren't included in consultations and surveys. And it's not enough in a survey to just say, are you 65 plus? Whereas, they designate all the other ages much more narrowly. Like, it's a really different being 65, being 75, being 85. And you're not really going to understand what people are saying unless you get down to that level. My second point would be better support, more support for older people's associations. And these are people who advocate for older people and with older people. They are older people. And it can be at the community level, like I work on the Council on Aging in Ottawa. It can be at the provincial level. It can be at the international level. There's a very strong organization working with the United Nations in terms of older people's rights. And then the last one also relates to what you're saying earlier is I really like and believe in intergenerational storytelling. We've seen a lot of really interesting projects where kids, students go into long-term care homes or seniors villages or whatever, and they create videos about the stories of older people and younger people. And I think that's a very powerful way to bring the voices of older people forward.
Nice. That's really lovely. Jim, you got any thoughts?
Yeah, I guess a couple of things. The simple one would be, how do we clone Gloria Gutman? That would be one real good answer.
Well, and Gloria's online, right? So
I saw her name there and I saw her face at the beginning. So Gloria is an amazing role model and champion of the voice of older people. So more Glorias, more Peggy's, more Irvs. Norma Drozdowich was a good friend and colleague in Manitoba. She was the chair of our Council on Aging. She passed away a year and a bit ago, but I used a slide with her picture in a lot of presentations, and the quote was, "Too often as I promote age-friendly change, I am dismayed at others' lack of advocating with me." And that always resonated because I know she was always frustrated when she'd make a pitch for an important cause and there weren't as many people, her colleagues around her, as she would have liked to have seen. So I think we need to build more supportive environments and encourage that voice of older people. And I think there's power in, I'll frame it as a choir of voices, but an intergenerational choir. I think the voice of older people by themselves is powerful with the wisdom that older people and elders can bring to issues, but I think it's even more powerful when it includes the voice of people from all of the generations. And the other part, take advantage of the opportunities when we have them. So as an example, in Manitoba, we had a Manitoba Council on Aging that Norma had chaired. We had a caregiver council that both reported to the Minister of Seniors. Governments change, both councils disestablished, and those voices lost. So when you do have a voice, use it.
nice, very nice. Sherry?
Thanks, Diane, and thank you for what you said and described. It was a very powerful, your family situation. From a policy perspective, we tend, as I pointed out in the slides, we tend to look at generation and count the money or the investment that we make separately. We tend to put people into these slots, and so somehow we need to figure out how to break down that, what are we doing for children and what are we doing for older adults, as though doing something for children is not relevant to older adults, as though it doesn't count, in terms of what health over the life course. I agree with my colleagues and everything that they've suggested in terms of this kind of intergenerational conversation, but I would like to also ask children. I'd like to ask children how we can change our communities and what role they can play. I'd love to see this as a school project with your question asked to children and listen to what they would say too, because I think that their voice in this whole conversation is really important. Their awareness is important, but their thoughts are important too. Thanks.
No kidding. And, I know we've got some educators and academics online, and it would also be a really interesting question to pose to a health class, of those emerging adults to get their thoughts as well. That's great. So we do have a few questions, and we are going to go to those now. But maybe just in case we lose a few folks, do you think I could announce the winner of the book? So I just did a random, I downloaded the names of people that were actually attending. So not registrations, but people were actually attending. And I did a random sort and I landed on Yobam Yang. I'm not sure if I've actually said that right, but I hope I have. And so what we'll do is I'll share their email with the publisher, and the publisher can get in touch with them and send the book. So congratulations, very good. So one of the first questions came up when Sherry was speaking, but I think anyone could comment. When people are living in those congregate housing settings, why are they lonely? Why are we not facilitating friendship and if we don't know how, why are we not finding out? So is that difference between being lonely and being alone? So any comments around that?
Perhaps we can clarify, do you mean in congregate settings? Do you mean in nursing homes or in some of the co-housing arrangements? Because
I meant to say housing. I meant to say congregated housing. Yeah.
Housing in some of the co-housing arrangements.
Yeah.
Well, it would be interesting to hear from some people on the line who may be involved in organizing these or living in some of these arrangements, but I'm not sure that many of the people in these arrangements are actually are lonely. Maybe it's, I think it's more with respect to, senior housing and long-term care. I think, maybe the question had to do with the long-term care perspectives, because I think that, as I said, there are some good congregate care arrangements, and I know many people actually living in congregate care arrangement who very much appreciate the company and who are not feeling lonely. But I know many others who are really living in their own rooms and who are not encouraged to go anywhere. And certainly with the pandemic, we saw that exacerbated for sure. But we know that loneliness is a serious social problem throughout the developed world because of the way that people are living on their own primarily. In fact, in the UK, there was a minister of loneliness who was appointed to address the problem. So it's a good question. I think we have to sort of look at what arrangement are we talking about, and then address what is causing that and what can we do to address that.
Can Peggy say something here?
Of course.
Okay. Yes, I think it's the issue here in congregate living is primarily around the retirement homes and the long-term care home system that we have in Canada, which is largely an large institutional based system. And in the book, Pat Armstrong, who's well-known researcher in this whole area of nursing homes, talks about this and about loneliness and in these large institutional settings, and it doesn't have to be this way. There are, as Sherry's mentioned, there's many models, like in Denmark, for example, of smaller long-term care homes, nursing homes in the community, where there's a sense of community, where people are not isolated. She also points out, though, that it's not always the answer. Small homes are not always the answer. They're one model that works. But even if we have to have larger homes, we can use models like there's the butterfly model, there's the greenhouse model, there's models of creating communities within these larger institutions so that people feel a part of a community and not lonely. So it's a huge question. And the whole move towards person-centered care and creating communities within institutional care and congregate care is a really important one. And it's getting a lot of traction politically. I think certainly in Ontario, and I'm sure across the country as well. So that's a policy area we really need to work on.
Nice. It makes me think about a number of years ago, I heard former Chief Sylvia Miracle of Tyendinaga First Nation speak, and she said, imagine the life of a child whose community is happy to see them every single day. And something in what you just said, Peggy, made me think, imagine the life of our older adults whose community is happy to see them every single day. There was something there in what you said. There's a bigger approach, I think. We have another question that I think builds on this, but is speaking to my heart. So is the notion of accelerated aging due to a lifetime of stress and exposure to health and social inequities? Is that even on the radar in the development of healthy public policy for aging? Opinions or thoughts from anyone?
Diane, I'm sorry, Diane, can you repeat it? Because there was a bing when you were talking on the computer.
Oh, yeah, of course. So is the notion of accelerated aging that's due to, a lifetime of stress and exposure to health and social inequities? Is that even on the radar of development of healthy public policy when it comes to aging and healthy communities?
I might do a quick response to that. What a very engaging and difficult question. The public narrative and what the stats would say is that, in fact, we are living longer and we are living healthier. In fact, there has not accelerated aging. It is the opposite. But what I think the person who's asked this question is saying, and this is really important, that there is a group of older adults who have experienced accelerated aging due to lifetime stress. Okay, so it's once again an equity issue. And no, I've never even heard that term talked about in terms of accelerated aging. And yeah, it's something to really think about in terms of policy. I mean, we always take the approach of, we want to maintain healthy aging, and this is the way to do it. But, we also need to be looking at, we need to really go downstream and look at those people, the old health promotion philosophy, those people that are, falling into the stream and over the river. And it is because of those early and long time stresses. And perhaps we need some policies that really address that.
I agree with you, Peggy, absolutely. And I don't think this is on the policy radar screen. It's an excellent question. Yeah. But what we do know is the links between longevity and low income and poor health. So there have been studies linking, poor health outcomes with income levels and those stresses. So we have some data, certainly, but we haven't really, I guess, taken that data and translated it and embedded it into the narrative that we need to.
Yeah, Jim, did you want to add a comment before I go to the next question?
Yeah, just real quick, and actually on the previous question too, but
sorry.
No, that's fine. I think, your opening, Diane, and the story of your family and my story of my wife's family, opposite experiences, yet at the same time, my wife's family was a farming family, rural Manitoba, tough life, a lot of poverty, a lot of the same issues. So I think it's we got a lot more to learn and rely upon our research community to help us better understand those kinds of dynamics, I think, and bringing it back from a determinants perspective. And how does that ultimately play out in terms of how people age? The other thing I just wanted to say on the loneliness piece is we need to not lose sight of the 93% or so of older people that are living in the community, many of whom are also lonely. We're just working on a project in Manitoba right now that's sort of building the link around communications and key players, and how do they communicate? Do they realize how important their information is? Is it getting to the people that need it to get it? And to what extent is there then a relationship between poor communication and more isolation and loneliness at the community level? So I think we need to also not lose track of some of those dynamics at the community level as well.
Yeah, absolutely. Especially when we talk about mental health, right? In that context and social isolation. That's excellent. Okay, and you had other?
Good.
Okay. That's awesome. Thank you. So we had another question. I'll just read it out here. There's many cultures where older people live with extended families instead of in large institutional settings or models where communities are created by bringing younger people and even children into the centers for daytime care or full-time living. And certainly I've seen situations where daycares are actually hosted in long-term care facilities and the generations are brought together. So is that something we should be looking at? What are thoughts around that?
Maybe can I jump in, Diane? It's certainly, it's one of the options that I mentioned in the, in that list of, in that continuum where we now have, on one end of the spectrum, living alone with some supports, if you have those supports, and then congregate care or institutional care. And one of the ways to fill in that continuum is this intergenerational living, same families as other cultures have done. But what I think people face is the fact that there are few housing options available to them unless they themselves put in the money to either make the space available or make that place accessible to the older relatives or grandparents. It's not going to happen. We just don't build communities like that. And I know in some parts of the country, for example, like Peel region was struggling with this, where there weren't enough apartments that had sufficient rooms for intergenerational living. We just don't build that way. And so, this is where we need a broader conversation, including the developers and the community planners and the people who are involved in community design, because we lack our housing supply to respond to this really, really important social need.
And just, I can jump in just with another perspective on community PHOA in Manitoba, on that age-friendly journey. And two things that they did that I thought was really neat. They had a building that was served as a senior center during the daytime and served as a youth drop-in center in the evening. And like once a month, they would organize a potluck dinner between the daytime users and the evening users, which is a great intergenerational activity. And they also created a community band that was also intergenerational. So you had high school students, junior high students, and seniors in the community in the same band playing music together and learning. So I just think that, again, in the community, we need to do more opportunities like that. And to Sherry's point and others, that, the housing arrangements and the models, we need to step back and look at, I think from that age-friendly perspective, all of those different elements to make, we can make a personal care home more age-friendly. How do we do that? Well, there's lots of ways that we can do it. We can make seniors housing more age-friendly, lots of ways to do it. So I think it's just important that we don't lose sight of those opportunities.
Yeah, and if I could add very quickly, building more on what Sherry has said, if the Vanier Institute of the Family has some fabulous research and fact sheets. And one of them is that although there's still a small number, the largest growing new kind of housing, if you will, or living arrangements is 4-generational. And this is largely due to immigration, the large immigration in Canada and from other countries where this is more not only acceptable, but preferable. And as Sherry has said, the problem is the actual housing, getting developers to understand this and to build for this. There have been some very exciting examples, and they're largely coming from the Asian community, where this is more common, like just of how to build a facility, a home that is good for 4 generations. So I think this is a really exciting area, but it's a huge advocacy area because this is not traditionally what our developers have done.
Yeah, that's interesting. Learning from other countries and places that have done something, right? The examples that have been set. So we got one last question that I'll pose, but ask for quick responses, although it's actually a really, really hard question. The question and there's a comment. Freedom to do what you want is really empowering. So the question is, why do we limit our older people who are in care? So that's hard. That's hard, and we might not be able to completely dive in, but so is it, why do we limit our older people in care, but how can we maybe improve their sense of empowerment in care? So quick thoughts from each of you.
Okay, I'll go first really quickly. This is a huge issue. And the underlying thing here is protection versus autonomy. Like, when do you side on protecting vulnerable people who may be in care versus their autonomy? And, I think the whole gerontology, geriatric approach to this is really important, that sometimes it's worth taking risks to maintain autonomy, and careful, cautious risk, but taking risks to maintain autonomy, and and allowing and recognizing the resilience of older people, even in very, very difficult situations.
I'll just really quickly add, agree with Peggy, the resourcing of our long-term care facilities, the ability to staff them adequately and consistently. And then secondly, there's a design feature that with better design, we have more opportunities to engage and empower the residents in their home. My mom's in a personal care home right now. And one of the things she loves to do is fold the bib that they use at mealtime, folds it perfectly. Well, she and others could be doing the laundry and doing those kinds of tasks and feeling like they're making a contribution. And we have some models that start to do that. But I think it's right now it's a resource issue, and it needs to be addressed.
Sherry, last word.
Yes, and I just want to build on what my colleagues have said, because I know that in the disability community in particular, this issue of risk and your right to take a risk is a big question. And oftentimes services jump in and they want to, make sure everybody's safe and protect everybody. Sometimes it's an insurance kind of thing, and worrying about lawsuits. And but I think we have to, as Peggy was saying, respect the right to take a risk if it's within reason, of course. This also comes down to the way in which we design our communities, and just look at the dementia village example, where it's a totally different design than having somebody in their own little room. And so you make a safe community. If you make a safe space, then you enable people to, or ensure that they can take some risk, and it's okay because it's within the development of a safe environment. So but that was a great question, and certainly a lot of work to do as well. Thanks.
Yeah, great question and great responses, because actually as I'm listening to your responses, I'm thinking, it's a hard question, but there really are possibilities. At first I read it, I was like, oh my gosh, I don't know, but there really are possibilities. And a couple of things that you said, Peggy, you mentioned resilience, and that's a really important concept. And I think we have to remember that people as individuals aren't necessarily resilient. They can navigate life with resilience if there are the right supports and resources and villages and communities around them. We can't blame an individual for not being resilient. It has to do with what is around them that allows them to be that way. And I'm thinking about too, Sherry, what you were just saying, and it makes me think about and are we approaching the care of our older adults with an asset-based approach or with a deficit-based approach? Are we approaching it from what factors would help promote their health, or are we approaching from a risk reduction perspective? And in the health equity world, we like to use the asset-based approach and the health promoting approach as a way to really reaffirm what people have to offer. And I think we get further on an equity level that way. So with that, I do need to end. We are just about at our time. I'd like to
say a last word.
I can't cut Irv off. Yes. Go ahead.
This is about policy. It occurs to me that a very good model for advocacy, which affects policy, is Costco, not the shopping center, but the organization of organizations within British Columbia called Council of Senior Citizens of British Columbia. They work together beautifully in discussing the issues that we're talking about here, and on putting pressure on government to deal with seniors' issues. I'm not sure whether or not other provinces have that same kind of arrangement, but it might be something that some of the other provinces might want to look at. And it might also be a model that could be used for other age groups across the population. And if you had a strong set of organizations, you could link them all and really get some pressure put on governments to develop policies both for individual groups and across groups.
Yeah, it's collective, collective power and voice, right? Thank you, Irv. That's a really great way to end today. I just want to say thank you to everyone for sticking with us through this. It was an amazing conversation. Ask you to please fill out the evaluation and always get in touch. I've got contact information here for NCCDH and for Health Promotion Canada as full co-partners in doing this series, and join us for the next one in February. And with that, I'll close. And thank you, everyone. This has been great.